Hi, I am Sandra Whitmore, and I am a certified physical therapist who has spent more than 20 years working with people over 60 on exactly one category of problem. Not falls, not back pain, not shoulder injuries, though I have seen plenty of all of those. My focus, the thing I keep coming back to, the thing that fills my waiting room and occupies my thoughts and drives the work I do in videos like this one, is circulation. Specifically, what happens to the circulation in your legs as you get older and what you can do about it. Today I want to talk about something that most people dismiss entirely. I want to talk about your feet. Not just your ankles, not just your calves, but your feet. The bottoms of your feet. The spaces between your toes. The way your feet feel first thing in the morning and the way they feel at the end of the afternoon. Because I have come to believe, after 20 years of clinical work, that your feet are the most honest communicators in your entire body. They will tell you exactly what is happening with your circulation if you know how to listen. And most people do not know how to listen. They ignore what their feet are saying until the message becomes too loud to ignore, and by then, the conversation is harder to have. Let me tell you about a woman named Carolyn. She was 63 years old when she first came to see me, and she was frustrated. She had been to her primary care doctor twice in the past year with concerns about her feet and legs, and both times she had been told the same thing. Everything looks fine. Your circulation is normal for your age. Just keep moving. She kept moving. She walked regularly. She did her best. And yet her feet continued to bother her in ways she could not quite name. They felt numb sometimes, especially in the morning, the first 15 minutes after she got out of bed. They felt cold, even when the rest of her was warm. They ached in a low-grade, diffuse way by the end of the afternoon that made her want to take her shoes off the moment she got home. And occasionally, usually in the evening, she would look down and notice that her toes looked slightly puffy, rounder than they seemed in the morning, with a mild redness across the ball of the foot. Her doctor had said her circulation was normal for her age, and technically that was probably true. She did not have any severe diagnosable vascular disease. Her pulses were present. Her skin integrity was intact. Her ABI, which is the ankle brachial index that doctors use to screen for peripheral artery disease, was within normal limits. But here is what I have learned over 20 years that medical appointments of 15 minutes do not always have time to communicate. Normal for your age is not the same as optimal. Normal for your age means you have not yet crossed the threshold into diagnosable disease. It does not mean your circulation is working as well as it could be. It does not mean the subtle, persistent, low-grade symptoms you are experiencing are not real or not worth addressing. And it absolutely does not mean there is nothing you can do to improve things. Carolyn's feet were trying to tell her something. They were trying to tell her that blood was not reaching them as efficiently as it should be, and that the blood that did reach them was not returning upward as effectively as it used to. Morning numbness is a classic sign of overnight circulatory stagnation. Cold feet are a sign of reduced arterial inflow to the extremities. End-of-day aching and puffiness are signs of venous pooling and early edema. Taken individually, each of these symptoms is easy to dismiss. Taken together, they tell a coherent story about a circulatory system that is working harder than it should be to do its job. I want to explain the physiology of what your feet are trying to tell you, because I think this is genuinely important and genuinely underexplained. Your foot is the most distal point of your entire vascular system. Blood has to travel the full length of your leg to reach it, and then it has to make the full return journey back. It is the end of the line for your arteries and the beginning of the return route for your veins. And because it is so far from your heart, it is also the first place where circulatory inefficiency shows up. When something is not working well in your venous system, your feet know before your ankles do. When your arterial supply becomes less robust, your feet feel it before your calves do. Your feet are also extraordinarily rich in circulatory structures. The sole of your foot contains a dense network of arteriovenous anastomoses, which are direct connections between tiny arteries and veins that allow blood to flow through the foot without passing through the capillary bed. These anastomoses are regulated by the nervous system and play an important role in temperature regulation and in maintaining venous return. When they are working well, they help blood move efficiently through the foot. When circulation is compromised, they are among the first structures affected. And then there is the plantar venous plexus, which is a network of veins in the sole of the foot that acts as a blood reservoir. When you walk, the impact of each step compresses this plexus and pushes blood upward into the deep veins of the leg. This is another component of what I call the second heart system, the network of mechanisms throughout your leg that helps your heart return blood from your extremities. When you are not walking, when you are sitting still for long periods, this plantar plexus is not being compressed. The blood in it stagnates, and over time that stagnation contributes to the pooling and swelling that Carolyn was experiencing. So what did I do for Carolyn? I taught her to listen to her feet, and then I taught her to answer back. Let me give you the first exercise I gave her, which is one of the most effective things you can do for foot and lower leg circulation, and which almost nobody thinks to do. It is called the toe curl and spread sequence, and it works in 2 phases. In the first phase, you sit in your chair with your bare feet flat on the floor, or if you prefer, with your feet slightly elevated on a footstool. You curl all 10 toes downward, as if you are trying to grip the floor with them. Hold that curl for 3 seconds. Then, in the second phase, you spread your toes as wide as they will go, fanning them outward in both directions. Hold the spread for 3 seconds. Curl, hold, spread, hold. That is 1 repetition. Do 15 repetitions on each foot, or both feet simultaneously if that feels comfortable. Now let me tell you what is happening when you do this. The plantar venous plexus I mentioned, the blood reservoir in the sole of your foot, is located between the layers of tissue in the ball and arch of your foot. When you curl your toes, you create pressure changes in those layers of tissue that compress the plexus and push blood upward. When you spread your toes, you activate the intrinsic muscles of the foot, the small muscles that run between the bones, and those muscles create additional compression and release. The combined effect is a pumping action in the sole of the foot that moves blood out of that distal reservoir and into the upward flowing venous system of the leg. Studies on foot exercises for venous return have shown that even passive compression of the plantar surface, the kind that happens when you simply stand up, produces measurable increases in flow velocity in the popliteal vein behind the knee. Active toe exercises, which involve muscular contraction rather than just passive weight-bearing, produce even greater increases. You are essentially using your own toe muscles to pump blood out of your feet. Carolyn looked at this exercise with the same mild skepticism that most of my patients display when I first show them something this simple. She said, "Sandra, I expected you to give me something more dramatic." I said, Carolyn, the dramatic things are dramatic because they are hard. The effective things are effective because the body responds to them. This is effective. She did 15 repetitions. She looked up and said, "My feet feel different." I asked her to describe it. She thought for a moment and said, "Warmer and a little tingly, like when a foot that fell asleep starts to wake up." That is exactly right. That is peripheral blood flow returning. The second exercise I gave Carolyn is called the marble pickup. This is one that I love because it requires no special equipment and produces strong circulatory stimulation through the sole of the foot. You place a few small objects on the floor. Marbles work well, but crumpled paper balls or even rolled up socks will do. And you use your toes to pick them up, one at a time, and place them into a bowl or move them a few inches. The gripping action required to pick up an object with your toes involves a complex contraction of all the intrinsic foot muscles simultaneously, which creates the most thorough compression of the plantar venous plexus you can achieve through exercise. I also taught Carolyn to do what I call a foot massage circuit every evening. She would sit with one foot resting on the opposite knee, and she would use her thumbs to press firmly along the length of her arch from heel to toe, then across the ball of the foot, and then gently along the length of each toe from base to tip. This is not a glamorous medical intervention. It is something she could do herself for free in 5 minutes while watching television. But the manual compression it provides to the plantar venous structures produces real increases in venous return from the foot. Physical therapy research on manual compression of the foot has shown improvements in distal circulation comparable to low-intensity ankle exercises. The foot wants to be compressed. It is designed to be compressed with every step. When you are not walking, you can substitute manual compression and exercise to provide something similar. After 6 weeks of doing these exercises consistently, Carolyn called me. She said the morning numbness was gone, not reduced, gone. She said her feet were no longer cold in the evenings. She said the end-of-day aching had dropped from something she noticed constantly to something she noticed occasionally, on days when she had sat for particularly long stretches. She said she looked at her feet differently now. She felt like she was in a conversation with them rather than ignoring them. That is what I want for you, a conversation with your feet. Now let me also talk about what the feet tell you when things are going in the wrong direction, because I think this information is genuinely protective and undershared. The warning signs that your foot circulation is getting worse rather than better include several things. Skin that becomes shiny or thin over the top of the foot and lower ankle, as if it is being stretched from the inside. Toenails that thicken or grow more slowly than they used to. Hair loss on the lower legs and feet, which indicates reduced arterial supply to the skin and hair follicles. Wounds on the feet or toes that heal more slowly than they should. And color changes, either persistent redness that does not resolve when you elevate the foot, or a bluish or purplish discoloration in the toes when your feet are dependent, meaning hanging down below the level of your heart. Any of these signs warrant a conversation with your doctor rather than a home exercise program. I am not in the business of scaring people, but I am in the business of making sure people have the information they need to take the right action. For most people, though, the story is not one of severe vascular disease. It is the story of Carolyn. Mild, persistent, dismissible symptoms that are absolutely worth addressing. And the good news is that the body is remarkably responsive to the right kind of attention, even after 60, even after years of circulatory neglect. Here is the daily foot and leg routine I put Carolyn on, which I now recommend to most of my patients with similar presentations. Morning. Before you put your shoes on, toe curl and spread sequence, 15 repetitions. Ankle pumps, 20 repetitions. Heel raises from seated position, 15 repetitions. Total time, 3 minutes. Throughout the day, every hour of sitting. 20 ankle pumps. That is 1 minute. That is all. Evening, while watching television or before bed. Foot massage circuit, 5 minutes per foot, pressing along the arch, across the ball, and along each toe. Marble pickup or equivalent toe gripping exercise, 1 to 2 minutes. Ankle circles, 10 in each direction on each foot. Total time, 12 to 15 minutes. This is not an arduous program. It is 15 to 20 minutes of total attention distributed across your day. But it is targeted attention based on an understanding of how your foot and leg circulation actually works, and it produces real results in real people. I want to say something about footwear because it belongs in any serious conversation about foot circulation, and it is something I raise with almost every patient I see. The shoes you wear matter more than most people realize. Shoes that are too tight across the forefoot compress the plantar venous plexus and restrict the toe spreading motion that is so important for intrinsic foot muscle activation. Shoes with a very narrow toe box push your toes together and prevent them from fanning outward, which is the motion that drives blood out of the distal venous network in the foot. And shoes with any significant heel elevation, even a modest 1 inch, keep your calf in a chronically shortened position throughout the day, which makes it less effective as a venous pump and more prone to cramping. I am not saying you need expensive orthopedic shoes. I am saying that when you are at home, barefoot or in flat, wide-toed slippers is meaningfully better for your foot circulation than any shoe with restriction or elevation. A wide toe box, a low heel, and a firm but not rigid sole are characteristics that support rather than compromise your vascular health below the ankle. I also want to address thermal sensitivity. Many older adults with reduced foot circulation find that their feet are easily chilled and that cold feet become painful or numb over the course of the day. This is partly a consequence of reduced arterial inflow and partly a consequence of the vasoconstriction that cold temperatures trigger. When your feet are cold, the small blood vessels near the skin constrict, further reducing flow to tissues that are already receiving less than optimal supply. Keeping your feet warm with well-fitted socks that do not leave a constriction mark at the top when you remove them helps maintain vasodilation in the peripheral vessels and supports better overall flow. A 10-minute warm foot bath in the evening is one of the simplest and most enjoyable interventions I know of for foot and lower leg circulation. Not hot, but comfortably warm. The heat dilates the blood vessels in your feet, increasing arterial inflow and reducing the venous stasis that has accumulated through the day. Alternating warm and cool water soaks, if you can tolerate the temperature change, produce an even greater circulatory response through the repeated vasodilation and vasoconstriction cycle, which acts as a form of passive vascular exercise. Carolyn is now 66. She sent me a message a few weeks ago to tell me that she had been on a 2-week trip to visit her grandchildren in Arizona, which involved a lot of walking on uneven terrain, heat that she would previously have found very hard on her legs, and 2 long flights. She said her feet and legs felt better during and after that trip than they had on any trip she had taken in the past decade. She said she listened to her feet the whole way through, and her feet had good things to say. That is what this work is for, not just the absence of swelling or the absence of pain, but the presence of capacity. the ability to go where you want to go, for as long as you want to go there, without your legs telling you to stop before you are ready. You can do this from your couch. No excuses. 5 minutes a day changes everything for your legs. I am Sandra Whitmore. Thank you for being here, and I will see you in the next video.